Yeah, you did fantastic. That was perfect. We're all done here. Yeah, you're good. Take this off, okay? Fast.
Yep, that's fast.
Done.
Done.
Wow.
Got a couple little things that
Thanks again. See you.
All right, and these ladies are gonna get you out of here, okay? You take care. Call us if you need us.
That was fun. I honestly was like, I thought they were just still getting ready for the surgery, and it's already done.
And you're done. That's it.
Like,
You're done.
That's what I was like, oh, when is it gonna start?
How are you feeling?
I'm good.
Good?
Yeah.
Feeling good?
I feel like you said, like the IV was like I was having a couple cocktails. It feels like I've had a couple cocktails. So I'm good with that.
Go home and rest.
So I'm just gonna go home and veg out and relax.
Get ready
Be able
for
to.
tomorrow.
I get a, what is it? 2 days. 2 days I'm not supposed to do. So I can have my wife do all the farm work for 2 days.
This is it. It's the only time you get. Take advantage.
Be like, oh man, I don't want to feed the turkeys today. Like, I'm not gonna lift more than 20 pounds. Like, so no, it's pretty exciting. I'm definitely gonna recommend it for anybody.
Congratulations.
I'm wearing
first time.
glasses. I'm 36. I started wearing glasses when I was 2. After I fell off the steps and broke my collarbone because I couldn't see the bottom step. And so, 34 years. It's a little emotional. Like, I mean, it's legit a little emotional. I've worn glasses for 34 years. And I can see perfectly fine now out of my left eye. Minutes after the surgery was over. Wow.
He's ready to go take you.
Oh yeah, I'm ready.
I'm sorry. At all.
Oh, this is where I strip out. It's over one.
So let me go call him.
Yeah.
Okay.
I'm gonna give this to you. Let's see how good we're doing. Cover your right eye for me. And when you are ready, read those out loud.
CZNGB.
Good. And here.
EBZDV.
Very good. And this one.
TPSHL.
And here.
It's gonna be OTBVS.
And then anything here.
Looks like EGSCT.
I'm gonna go down again. What about here?
I would say that is it's a little bit harder, but it looks like CMFZV.
Okay, put that down for me. That's 2015 minus 2. That's one line smaller than 2020.
Sweet.
Very good. I'll get that from you.
My dad has. I can see this. I don't know if you can even see it on the thing. With my left eye with the correction, I can actually read that.
Yeah, I tell you what, the numbers are pretty amazing. So you're already at 2015 in this eye. So the left eye, is 2015. The right eye, you're legally blind. So without correction, you're 2020 or 2200, which is considered legally blind. And then here we are, 24 hours after surgery, and you're already reading 2015.
Yeah,
Pretty
I'm
sick.
excited.
Pretty sick.
Like, I mean, it's insane.
Yeah.
Like, let's take a look.
Come on.
I'm like, you can't see the different.
Yeah.
Like, no, it's actually like 3 different shades of black.
Yeah. So we have people that will, literally, like repaint their kitchen.
Yeah.
Because they think their kitchen is, blue and it's like seafoam green.
Yeah. I started seeing all the scratches on my floor.
Yeah.
I was like, have those always been there? And
Yeah.
she's like, what are you talking about? I'm like, you don't see all the scratches on the floor?
Yeah, it's life changing, and that's one of the most special parts is seeing the world as it should be. You know, in many cases, people used to see, well, I guess in the you know, older cataract patients, they remember seeing like this, and now and they got taken away from them. So that's great.
Yeah. No, I mean, I can honestly say, I mean, I've worn glasses since I was 2. I don't ever remember seeing
Like this.
Like this. Like it legit almost brings me to tears.
Yeah,
Like, I mean,
yeah.
like,
People cry all the time.
like,
We
it's
got a lot of
amazing.
criers. It's tears of joy,
Yeah.
and thank you, man. I appreciate it.
Cool. So, question for everybody that's watching it.
Yeah.
In my type of work where I am outside 8, 10, 12 hours a day, working around a lot of dust, working a lot around chickens and chicken poop and things like that, what would be the best thing for somebody like me to do to prevent this from, because I imagine there's certain things like the sun and things like that that could be contributors to cataracts or just general eye issues.
Yeah, I mean, I think that you know, the biggest cause of cataracts is age,
Yeah.
right? And so you're a unique situation because you're so young.
Right.
You know, other things can be blood sugar, you know, diabetes, right? So I'm doing cataract surgery. I think I'm like a 22-year-old who just has horrible type 1 diabetes, and so you can get it like that. Other than that, you know, in young people, trauma or something like hitting the eye. Let's say like you're working on a farm or you're outside doing something hits you in the eye, and you know, a year or two later you start to have some blurry vision. And you don't know what it is. Oftentimes that can be a traumatic cataract. So we had to do that in a 16-year-old, as young as 16. So cataracts just, you know, they're not just for older people.
Right.
The other thing we're learning about cataracts is that they start in your 50s, right? And so it's not an old person disease. Like usually by the time you're 50, 55, you have some level of cataract. And if it's bothering you and glasses aren't helping, you can fix it, whether you're, you know, 36 or 56. You know, it's just if glasses and contacts aren't doing the job anymore, you know, typically, you know, that's time to do it. Other than that, sunlight for sure is a factor. Cigarettes, right? So smoke is a factor. I don't know that dust or dirt or anything like that is an issue. You know, if anything, you want to just have good eye protection. So from sunlight, any type of UVA with UVB blocking sunglasses is good. You know, if you're gonna, you know, certainly be around a dusty, dirty place, you want to have some kind of way to sort of, you know, shield your eyes from that. You know, that'll prevent corneal abrasions. Corneal abrasions can classically lead to, you know, bacterial infections and things like that, which can take your vision. So you want to be careful with that. And the other thing I would say, you know, just kind of high level is if you're working on a farm, if you're working with chickens and animals and stuff like that, oftentimes it's the type of patient that doesn't come in and see the eye doctor, right? Even if they're actively in pain, you know, they'll go with a red eye for 1, 2, 3 days, you know, and just, you know, kind of go away, and it doesn't. And by the time they get to us, there's less we can do to help them. So I've had some patients who've had a full-on corneal transplant because they didn't let us know. So if you ever in a situation, you know, for all your followers, where you did get something in the eye, or you're not, your vision has decreased, or your eye is red, my recommendation is see the eye doctor that day, because oftentimes if we get to it early, there's something we can do for you.
Gotcha.
You know, even if you're not interested in or don't need vision correction or LASIK or lens replacement, you know, just don't ignore your eyes. You know, just an annual, once a year eye exam. The best thing about your situation and with your following, you know, on YouTube and elsewhere, you can sort of explain the different technologies and things that we have. Because when I tell people that I'm an eye surgeon, first thing they say is, "Oh, you did LASIK, right?" And I'm like, "Yeah, I do a lot of LASIK, and LASIK's great. I had LASIK on my own eye." But there's also like 8 other vision correction procedures we offer. And so they don't know about ICL or custom lens replacement or PRK or, you know, all these different technologies we have. And even within lens replacement, there's 20 different lenses that I can put in your eye. The lens that we use for your eye is kind of like the engine you'd put in a car. If you were building a kit car, based on how you want to drive, that's how you choose your engine. And so based on how you want to see, that's how we choose your lens implant. It's custom designed to you. Every single eye is unique. And so I think that, you know, a lot of people have already made up their mind for some reason, whether they need LASIK, don't need LASIK, and some of them are just thinking, well, I'll just wait until something else comes out. And it's like, well, we got a lot of other stuff right now. And so from age 18 to 80, You know, we have technologies for you. So I think that would be the message I'd hope to send to your following.
Yeah, cool, definitely.
Yeah.
That's awesome. I didn't even know that you had started the procedure. I mean, granted, I was out of it, but like I thought you guys were still getting ready,
Yeah.
and then you're like,
Drugs. Lots
"Hey,
of
we're
drugs.
done." And I was like, "Oh,
We
okay."
give you lots of drugs
Right.
for your eye surgery, but they're safe and legal.
Cool, man.
I love it.
All right, folks. I hope you enjoyed it. I hope you learned something from the video. I'll tell you now, it's insane. I mean, my vision, I went from not to see anything. Literally, my vision looked like this to looking like this. I mean, that's the best description I can give you. So, the world is new. The world is wonderful. The world is great. If you're having eye problems, please go see a doctor. Please see what your options are. You know, if you're just not living your best life, go see an eye doctor. I wish I'd done it a lot sooner. I was ready to say Homestead. Enjoy Homestead. And check out your eyes.